Hi, everybody. Welcome back again. So in our last video, we talked about the gut microbiome, why it was important. And so in this video, we're going to kind of build on that topic and kind of highlight into everything about fecal microbiota transplantation. So we're going to talk about what FMT is, where it came from, why are people studying it today, and where is it being used, and what are some of the key features or important things to know about FMT. And some fun things to understand why we know so much about FMT. Novel Biome, which is the company that Jason founded, that I work for, is a fecal microbiota transplantation, or FMT, contract manufacturer, which means we make high quality FMT products and we work with hospitals, clinics, physicians to get these products into their hands so that they can use them appropriately to help kind of treat different conditions depending on where they are. And we have a video all about the history of Novel Biome, and we talk a little bit more about how we got here. But originally, Novel Biome was direct to patient, treating patients using FMT to help restore people's health or deal with chronic conditions. And based on what Jason saw in the clinic, we kind of perfected making FMT products and then decided that's what we were going to focus on, because one of the big issues here is ensuring that you have high quality FMT products. And as we're seeing a build in the use of it, we want to make sure that we can help support more people by getting the right products into physicians' hands. Do you want to add anything there, Jason?
Yeah, I would just quickly say, if you haven't watched the video immediately prior to this one, or the audio immediately prior to this one, go ahead and watch that one, because we cover a lot of the foundational pieces that will help set up the understanding of why FMT works and why it's effective and why you should care about it. And a big part of the journey to where we are today, which we've talked about in other videos, has just really been driven by patients and the desire that we collectively share to help improve patients' quality of life and the outcomes that they're getting from their treatments, or the lack of the outcomes that they're getting, and how FMT really fits into improving many disease states quite dramatically when it's applied as it should, and with a really high quality product. And beyond, the manufacturing, of course, is an important one. The donor screening is a very important one, and we'll get into those things. But what's really hard, especially when you're a busy physician and you're working and seeing patients every day, all day, you don't have the time to manufacture it, and surely you don't have the time to keep up with the science, the latest developments in technology. And adding onto that, another layer is dealing with the regulations that surround FMT, the manufacture of FMT, which is considered a drug. And so we're covering all of those things as someone sort of back office lab, as a contract manufacturer for them, so they can focus on the patient care and getting the drug or product in the hand of the right patient. Again, as Shayna pointed out, depending on the regulatory environment that they're operating in. So yeah, really excited to be here and looking forward to sharing about this topic that I've become very passionate and dedicated much of my life to at this point.
So the first thing is, what is fecal microbiota transplantation? We have a lot of information on this, so let's go into kind of what's the high level of what FMT is. And so really what it is taking a healthy gut microbiome from a well-screened, healthy donor and using stool material, which is purified and manufactured under very specific kind of set of settings to extract the healthy, kind of a full healthy gut microbiome. So a profile of kind of what is making the gut healthy in the donor, and then is providing that to a recipient, which is normally someone who's in gut dysbiosis and needs kind of a replacement of the gut microbiome. So it's almost like a transplant from someone who is healthy, who has kind of, the best gut microbiome that you can kind of capture based on their health and their different medical profiles, and then transplanting that into someone who needs their gut microbiome to kind of be restored.
Yes, and it is a transplant, but a lot of times people say, I thought it was a surgery. They think of FMT as a fecal microbiota transplant, and most organ transplants require surgery, right? You're getting a lung transplant, let's say, or a liver transplant. They're taking it out of one person and putting it into another person. In this case, it's the microbiome. It's derived from a human stool, and it really, the product comes in different formats. We manufacture different formats, one of them being an oral capsule. And so it's in a capsule. It looks like a probiotic. It doesn't represent in any way the original raw material, which of course is the human stool. It's the concentrated microbes that exist within the human stool that we're really after. And that's what we're looking to transplant. And so it really gets away from, the name is kind of a dirty one. Fecal Microbiota Transplants has been trying to rebrand. Many people have tried to rebrand it as a microbiome transplant or a microbiome, therapy. There's just a lot of different ways it's trying to be rebranded, and I'm generally on board with it. But hey, the science keeps calling it FMT, and so we'll keep talking about it that way.
And so I think something that's interesting about FMT is it's not new at all. So we do have a lot on the history of FMT, but the history starts like over 1700 years ago. In 4th century China is the first reported use of FMT. Not as we know it today, but the use of fecal material as a treatment. So the fact that it's been around this long, but is now becoming something we're talking about, why do you think that we're seeing kind of resurgence of the idea of FMT coming back into? We're seeing it kind of in the 2010s, but we're now from something that's been around for forever, kind of. Why is it becoming popular now?
Yeah, it's interesting. I mean, I think it's the same question you could ask about a lot of the traditional medicines, right? Whether it was like the herbs that were used by traditional societies, the indigenous populations, like the reason these things persisted for hundreds, in some case thousands of years, is because they worked. And we just never understood in many respects. And that's still the case for a lot of medicines that are out there, whether natural, a lot of these alternative holistic medicines we just don't understand why they work. We just know that they do work. And I think the more modern version of it is because we're understanding what the microbiome really is, how it's manipulated both positively and negatively. And the science of the understanding has come a long ways. And so I think that's really why, it persisted for as long as it did, is because it worked. And now the more modern version of it, let's say the last 50 to 70 years, is because we've continued to study it. And we continue to now understand, the negative impacts that a damaged microbiome has, and then conversely, the positive effects and the benefits that a healthy gut microbiome that could be transplanted into a sick patient has. And so, I think ultimately, though, it comes down to it's existing still today because it works. And if it didn't work, we wouldn't be using it, because the whole concept of a fecal transplant is kind of not a very palatable idea. And so if it weren't for its really great promise and the benefits that we know it has, I don't think it would continue to exist in any forms today.
Yeah, and I do think you're hitting on a good point there, because it does work. It's very effective. But now that we're starting to understand, science started looking into the gut microbiome, we started seeing that its changes in different conditions played a role. And I think it kind of those two pieces connected together with understanding the gut and that it was playing a role, and knowing that this treatment really does have an impact not only on overall health but restoring the gut microbiome. And so when we from historic use to today, FMT looks a lot different than it did at that time. And so
Thankfully.
What are some of the purification, getting it down to just what we need from it is really key, and it helps enhance the safety of it. But what do you think the key features are that are important for FMT, or that everyone should be aware of when they're thinking of looking into understanding FMT? What are those key features that are important?
Yeah, I think the big ones are, first of all, is donor screening. So selecting the right donors and making sure they're screened to remove risk factors that we know contribute to poor health and chronic disease. So just quickly, and we touched on some of these health benefits that from lifestyle, for example, in our last discussion. But a donor that's been vaginally born, that's been breastfed, that has had minimal to no lifetime use of antibiotics, that's eating a broad omnivorous diet, that's physically fit and active, has a healthy BMI or body weight, and then the list just compounds. It goes on and on from there. So there's all of this sort of past medical history. There's a look at the family medical history to make sure there's no early onset of, say, our cancers that we know have some genetic implications. There's the look at the donor's active daily diets and lifestyle. But then beyond those factors, we want to look at their microbiome and their gut health specifically. And so we're looking at blood markers, we're looking at urine markers, we're looking at stool markers to see if there's anything pathogenic or infectious or imbalance or cause for concern. And a lot of that we can link to more information on our donor screening, because I think that's just a really, really important factor. Like, without a really healthy, carefully screened donor, that's going to have an impact on both the safety and the efficacy. Because if someone has a microbe, a pathogen, for example, and they're healthy or generally healthy, that they might not know about it. It might not be an issue for them, but it'll come up on testing, and that in a compromised patient could really cause a problem. So donors and donor screening are really just a critical core piece of what we do. And the standards for donor screening are, we obviously set our own company standards, but our company standards are based on the standards set by health regulators. And every country and jurisdiction has its own regulators. We're in Canada, so we're regulated by Health Canada. We have what's called a drug establishment license, which means we're licensed to manufacture and export FMT as a drug product. But other countries like the US has the FDA, Australia has the TGA. So they all set standards for donor screening and donor selection. And our goal is to meet and wherever possible exceed the standards, which I think we quite clearly do. And then the other part of this is the manufacturing. And so we need to make sure it's being done in a sterile, clean environment. When it was back in 4th century China, it was not being done that way. And, by all accounts, it seemed to be effective and from what we know, relatively safe. But there are some documented cases of adverse events, and those have been tied to improper donor screening. But it's kind of like when you're preparing food in your kitchen, like, it's clean. You want to keep your kitchen clean and not cross-contaminate, because if you do, you're going to increase your risk for food poisoning and let's say E. coli. Well, the same goes for a laboratory environment. So we're considered good manufacturing practice. So we have that standards, GMP it's called, and that's a standard that's international and is the highest level when it comes to a manufacturing environment. So it's basically meaning there's no cross-contamination between batches. You're retaining samples from every batch of everything that the actual product itself, the raw material, the finished product material, everything that goes into that product. You're keeping even the bottle that it goes in, so that if there ever were some sort of adverse event or some health outcome that was negative, we could go back and there'd be a trace back program. So there's documentation on top of documentation. There's environmental studies that are done. There's stability studies that are done on the products. And so there's just a lot of testing and a lot of documentation and layers of evaluation within the people that are doing the roles, whether it's a quality role or whether it's a production role, just to make sure that there's someone who's doing the work and then there's someone approving that the work is done. And so it's quite cumbersome from a documentation standpoint and a testing standpoint and an environmental testing standpoint. But it's all really a critical part of just making sure that if you're a healthcare provider listening to this and you're thinking about using FMT, that it's going to be very likely to not only be effective for your patient, but safe. And that, to me, is both a parent and at one point a healthcare provider, which is a really important part, right? Like, it's exciting to be in a field of medicine where there's a lot of excitement, there's a lot of research, and you want it to be effective, and FMT is effective. But without it being safe, that to me just wouldn't go over well. I wanted to make sure that anything I got involved with would hit both of those criteria. It would be safe and it would be effective. And some of the things that we do, again, donor screening and manufacturing, are what increases the likelihood of it being safe and or reduces the potential risks. Now, of course, risk is never eliminated with anything that you do, whether it's a natural treatment or if it's a pharmaceutical intervention. There's always the potential for risk, but those are some of the ways to help minimize or reduce the risk and conversely increase the likelihood of success and effectiveness in getting a desired health outcome.
Yeah, and another part of that, I guess, is consistency. By having these standards in place, every time that the product is made, it's made in the exact same way, with the exact same amounts of everything, and everything is measured and signed and double checked. But that makes sure that every product that's created goes through the same process and they're not different. So you have some consistency, which helps. But I think it's important to note that you have to do your due diligence when you're looking at products. Not all FMT products are created equal. Not everyone has to follow these standards. Not everyone is. Not everyone's donor screening is at the same level. So it is important to ensure that you're going with looking at products and understanding products that do follow these regulations, that are working with health bodies or health regulators to ensure that they are meeting those standards, that there is some external oversight is really important, that they are following manufacturing standards, that they are transparent about their donor screening, and that you ensure that understand what the donors are being screened for, because the donors where the product is being created from. So the level of scrutiny on the donors has to be extremely high. And so if you listen to our last video of the gut microbiome, that's what you're trying to capture. You're trying to capture a healthy version of it that has the right diversity, that has a good composition based on, the health history, the types of foods and exercise that's happening. So you want to understand that where the product is coming from is evaluating that. And that's something we pride ourselves on, but we're very transparent about it. If you go on our website, you can see all of this information. But it is important to understand you do your due diligence on any products and have conversations with the people who are manufacturing it so you can get a full understanding. And so we've talked about what FMT is, we've talked about the history and how we got here, and we've talked about what the key features are. So why are we talking about FMT? So what is it? What's the research saying about how it can be helpful? Where is it currently most widely being used? And then where else is it being researched? And I think the big point for me is in the last 5 years, went from 30 clinical trials looking at FMT to over 300. So that's a huge growth in the number of clinical trials. So one of the big things with FMT is where it's most widely used right now is for treating C. diff infections, and it is extremely effective. And so the average from the research is about 90% clinical efficiency, which is outstanding.
There's nothing that
kind of
compares
unheard
to it.
of.
I mean, you take any approved medication on earth, and none of them have that effectiveness rate. I mean, it's mind blowing how effective it is. And I think conversely, just to share some of the bad news, is that it's still killing thousands of people every year. And in the US, C. diff specifically is killing, again, the numbers vary year to year, but anywhere, between 20 and 30,000 people each year are dying from C. diff that's antibiotic resistant. And FMT, again, looking at the range of research that exists out there, 85, 90, even 90% plus effectiveness on the first treatment. And we're talking like a few capsules worth can turn a C. diff situation around, which is deadly for a lot of people. Because we have to factor in that generally these are elderly patients. They're generally, they picked it up in a hospital. They've often been on an antibiotic. And so they just have all these whammies that are coming at them. And then C. diff is something that can really just turn the tide for them quickly. And FMT in this context is just extremely effective, very fast acting. I mean, patients go from extreme diarrhea to healthy from hours to days. It's just really, really effective very, very quickly. And thankfully, again, of course, I've had my own experience in treating hundreds of patients when I was actively working as a physician. But to not take my word for it, just looking at the research that exists, around the safety and efficacy for, in this case, C. diff. It's really phenomenal. And so tell us, where else is FMT being studied? Where else is it being utilized? We know FMT for C. diff is a home run. Most regulatory jurisdictions are giving the nod and approval for FMT in the treatment of C. diff. And that's very exciting. We're very happy to see that. But it's coming for other conditions. So what are you seeing in the research?
Yeah, so where most of the early research for looking outside of C. diff came from is C. diff patients that had other conditions. And so that kind of brings us into some gastrointestinal disorders like IBD or IBS, which was people who had, say, Crohn's or ulcerative colitis, who got C. diff, got FMT treatment, but not only did their C. diff resolve, they saw huge improvements in their IBD symptoms, which led to people thinking, well, maybe we could use it here. So we're seeing a huge growth in the clinical trials, specifically for IBD. And there's less so, but still growing IBS. So gastrointestinal symptoms seem to make sense for looking at FMT, but that's kind of the beginning, the beginning jump off, because we're seeing growth in areas like autism spectrum disorder. There's a number of studies, and this is a growing area where we know that the gut is impacted early on, and that by restoring the gut to make it more neurotypical, we do see changes both in gastrointestinal symptoms and ASD-related symptoms. That doesn't end there. We see Parkinson's and MS. There's a number of clinical trials in this area. We're seeing long-lasting impacts after FMT treatment in the clinical trials. Another area that's newer is Alzheimer's disease. And this is a more interesting one because we see C. diff in a lot of elderly patients. And there were a number of case series where people had C. diff, but were suffering from Alzheimer's disease, were treated. And not only did they see changes in things like frailty and overall improvements after C. diff, but we're seeing improvements in memory as well, and cognitive scores, which I'll be honest, reading the case series, I don't think that was something they thought would happen, but we knew that there could be a tie there. So they were doing some of these early assessments. Most people who are suffering from Alzheimer's disease are regularly being assessed. And so these huge improvements between two assessments, and the only thing that had happened was they had gotten FMT. So now we're seeing new clinical trials in that area. We're seeing it with people with haptic liver diseases, where their liver has kind of been fairly destroyed, and seeing improvements in liver functions and things after FMT. There's some studies looking at it for asthma, for different autoimmune diseases. And so what we're seeing is that the
mental health as well, like bipolar. There's some really amazing case studies. And an area that I'm very bullish on, and that I think there's a lot of future in, is the role of FMT and the gut microbiome, specifically in improving the effectiveness of some of the existing therapeutics that exist on the market today. So a perfect use case is certain cancer drugs. There's cases where the patient's not responding. And so they've given that patient an FMT transplant, a fecal microbiota transplant, and then they respond to the same drug they previously didn't respond to. And that's a big problem in healthcare, is just the variability of response between people to the same drug. That's a problem, and or they once responded to it, but they've stopped responding to it. And so how do we help them be able to respond to it again, or respond to it in the first place? And in some of these cases, it's by giving them a fecal transplant. And to me, that is just such an exciting area, right? How do you take a drug that has shown to be positive and effective to a limited degree, but actually improve its effectiveness and improve the outcome that a patient can get? And in the case of oncology in the cancer field, that is just really so encouraging, because that's such a debilitating and significant problem that we're facing as a society and as individuals. So that to me is, I think, so exciting, and I can't wait to see that area expand and the amount of research there expand.
Yeah, and there is a good number of research looking at the synergistic, so kind of adding FMT in, and so not only in improving the the effectiveness of a drug, but we're also looking at it in the ability to reduce side effects or reduce the negative impacts of some of the treatments to help. So basically, restoring the gut helps kind of mitigate some of these negative impacts that some of these drugs, specifically cancer drugs, can have on the overall body. So you're not only just helping treat the cancer, but you're helping kind of restore the body so that it has kind of a better setup to keep fighting or keep improving. And we see it with stem cells as well, which it basically helps improve the initial outcomes. So it can add on to kind of improve what that treatment originally could do. So that's a whole other area. And that's kind of the interesting thing about FMT is that because it's got such a great it's a powerhouse for restoring the gut microbiome and kind of resetting it, the gut microbiome is playing such a big role. So we're seeing that it's being kind of used in a number of different areas. So not just treating disease, but as you mentioned, kind of can it be added on to treatment to kind of help those outcomes? And so I think we're going to keep seeing FMT being researched in more areas. And I think as this research grows, we're going to see it being used more widely in the clinic as we kind of get a better understanding of how it works and kind of what treatment protocols have the best outcomes. And so I think it's an area that I think we have known about for a really long time. We're understanding more about. We're getting a better understanding of what's important to ensure, higher levels of safety and efficacy. And then we're just watching the research grow and kind of getting a better understanding of the kind of what I feel like right now is the endless possibilities, or the, this kind of well of there's so much more we can look at. And as we see changes, we're seeing, certain conditions are tied to something else. Well, maybe it's this underlying thing that we could improve earlier on. So I hope to see FMT not only used, in chronic conditions, but maybe we can start understanding things a little bit earlier and maybe even have better outcomes as things go. So we keep an eye on all of this and try to get a better understanding. And that's something that, we really do want to share so people can kind of fully understand how outstanding this is. And if you can get past that, it might sound a little bit weird. You can see how great it can really be. And I think, outside of where it's being used, FMT is also growing in how it's being applied. For a really long time, it was only used really as enemas and colonoscopies. But we're seeing a huge shift in understanding how we can encapsulate and make it kind of more of a palatable and better for long-term treatment. So we're seeing growth in the use of capsules as well. Specifically at Novel Biome, we also have an oral powder that can be used for people who can't swallow capsules, and trying to create an alternative so that a wider scope of patients can have this as an accessible treatment. And so the oral powder is just mixed in and you can drink it. And that is a level of purity that I'm sure most people would not believe exists. But that's the idea.
So unique. It is so unique that the U.S. Patenting Office granted us a patent. And so it is really hard to appreciate, but it's important, again, as a part of our mission to expand access to FMT and work and help educate healthcare providers, was to allow the pediatric population. Dr. Kale just pointed out before the autism spectrum disorder, where the research is really showing a lot of benefit. And when I was involved in the treatment of patients, we treated a lot of patients with autism spectrum disorder and saw really phenomenal outcomes. And the protocol was based on research that already existed out in the field. And but that population struggles with taking either capsules or is not a big fan of other delivery mechanisms. And so oral capsules for a pediatric population or a population that can't swallow capsules was a really important piece for us as far as being able to help expand access. And early intervention for pretty much any indication, but in this context, autism has just been shown to have such positive and beneficial impacts on the progression and the sort of severity of either the diagnosis or the disease state. So yeah, it's exciting to have these other formats available that make it more accessible and easier to take for both the physician prescribing and or the patient taking the medication or treatment.
Perfect. All right. Well, I think we've covered it. And if you have questions or topics that you'd like more talked about on this, please leave us a comment, because we want to talk about or educate on the things that people want to know more about. And if you found this fascinating and want to learn more about FMT, we do have a free ebook. We'll link in the bottom in the description, and that dives into kind of the overview of FMT and kind of what it looks like and where it's going. And we also have a weekly newsletter that you can sign up for, and this will send you information about the gut microbiome, gut health, FMT, where the research is, and kind of try to give you a little snapshot of some information and where to get more if that's something that interests you. So
yeah. So if you're a healthcare provider and you're interested in learning more, reach out. We're also happy to have individual calls with people. I mean, education is a big part for us of why we exist, and being able to share the available research and educate doctors and healthcare providers is just a really big part of what we do and what we're really passionate about. So share this message with other people who you think would benefit from it. Share it with your doctor. If you're a doctor, share it with your colleagues, because I think together we can really spread the word of the power that FMT and the gut microbiome has, and knowledge is power.
Yeah, and then if you've got questions, reach out, because we're always willing to connect and answer any questions that you have as a healthcare provider. If you're trying to understand more about FMT and where it can fit into the puzzle, please reach out, and we'll do our best to answer all your questions. And thank you so much for watching, and we hope to catch you on the next one.